As the battle against COVID-19 intensifies in India and across the world, and the number of cases are being seen to continue rising, well, we bring you all the latest updates, all the news, both good and bad, and all the precautions, all the directives from the central as well as the state government in our program Tracking COVID-19. Hello and welcome. I'm Rukma. Let's begin by taking a look at the top stories we're tracking regarding COVID-19 at this hour. Centre denies all reports of extension of lockdown period. Cabinet Secretary Rajiv Gauba says all such reports are baseless. Centre forms 10 empowered groups and a strategic task force including senior civil servants to deal with the COVID-19 outbreak and its aftermath. 6-member strategic task force to deal exclusively with issues related to the lockdown. Home Ministry ex-staff against 4 top officials of Delhi government for showing laxity in effective implementation of lockdown. Suspends 2 including Additional Chief Secretary Transport and Principal Secretary Finance. Show cause notices to 2 others. Centre asks state governments to effectively deal with interstate borders as well as borders between districts to be sealed. Under privileged sections to be provided shelter and food. Centre directs allowing free movement of trucked goods. Asks states to ensure labourers get their wages and are not harassed by landlords. Prime Minister Narendra Modi at the helm of India's fight against COVID-19. PM Modi continues to interact with over 200 stakeholders and people on a daily basis, also gets first-hand feedback from various quarters. Total number of active corona positive cases in the country stand at 901. 27 people have lost their lives. 95 have been discharged after recovery. Maharashtra and Kerala have maximum number of active cases. Several social organizations come forward with innovative ways to help tide over corona crisis. Social organization in Trichy, Tamil Nadu provides robots for treatment of patients. Global death toll due to COVID-19 goes past 30,000 while corona positive cases touch 7 lakh. Italy, Spain, US and France most affected. All countries take strict steps to deal with the pandemic. Death toll in Italy goes past 10,000. Spain hits unfortunate level of 6,000. New York death toll passes 1,000 out of a total 2,500 deaths in the US. And as India entered day 6 of a 21-day lockdown to check the spread of coronavirus, Cabinet Secretary Rajiv Gauba said the centre does not plan to extend the lockdown. The Cabinet Secretary has clarified that the government had no such plans of extending the 21-day nationwide lockdown. The Press Information Bureau in a tweet said that there are rumours and media reports claiming that the government will extend the hashtag lockdown21 when it expires. The Cabinet Secretary has denied these reports, stating they are baseless. And the government has set up 10 empowered groups and a strategic task force including senior civil servants to deal with the COVID-19 outbreak and its aftermath. These groups have been set up under Disaster Management Act. The groups have been empowered to formulate plans and to take all necessary steps for their time-bound implementation. The Department of Expenditure has issued special instructions to enable expeditious decision-making in procurement matters. Each group has senior representatives from the PMO and Cabinet Secretariat to ensure seamless coordination. Of these 11 empowered groups, 9 are headed by the secretary-level officers, 1 by member Niti Aayog and 1 by CEO Niti Aayog. In case of any need for guidance, these groups may seek guidance from Union Cabinet Secretary. And the Ministry of Home Affairs on Sunday night suspended 2 top officials and issued a show-cause notice to 2 others on charges of failing to ensure the COVID-19 lockdown in the national capital effectively. MHA in a statement said that these officers have failed to ensure public health and safety during the lockdown restrictions to combat COVID-19. Additional Chief Secretary Transport Renu Sharma and Principal Secretary Finance Rajiv Verma were suspended with immediate effect due to serious lapse in their duties to enforce the lockdown in the capital, while Additional Chief Secretary Home and Land Buildings and the Sub-Divisional Magistrate Selampur have been issued show-cause notice. And the centre has directed states to enforce strict implementation of lockdown. In an official directive to states, the centre has asked them to enforce lockdown strictly. The Cabinet Secretary and MHA are in constant touch with state chief secretaries and DGPs. The video conferences were held by Cabinet Secretary and Home Secretary with chief secretaries and DGPs. By and large, there has been effective implementation of guidelines across all states and union territories. Essential supplies have also been maintained. Situation is being monitored round the clock and necessary measures are being taken as required. However, there has been movement of migrant workers in some parts of the country. Directions were issued that district and state borders should be effectively sealed. States directed to ensure there is no movement of people across cities or on highways. And only movement of goods should be allowed. DMs and SPs should be made personally responsible for implementation of these directions, which have been issued under the Disaster Management Act. Adequate arrangements for food and shelter of the poor and the needy, including migrant laborers, be made at the place of their work. Centre had issued orders for use of SDRF funds for this purpose. Sufficient funds are available with states in this head. States have been also told to ensure timely payment of wages to laborers at their place of work during the period of lockdown without any cut. House rent should not be demanded from the laborers for this period, and action should be taken against those who are asking laborers or students to vacate the premises. Those who have violated the lockdown and travelled during the period of lockdown will be subject to minimum 14 days of quarantine in government quarantine facilities. Detailed instructions on monitoring of such persons during quarantine have been issued to states. It was impressed upon all the states that 3 weeks of strict enforcement is essential to contain spread of coronavirus. This is in the interest of everyone. And Prime Minister Narendra Modi is continuing his interactions with various stakeholders in India's fight against COVID-19. The PM interacts with over 200 people on a daily basis, which includes phone calls to various state governors, chief ministers and health ministers to get first-hand feedback on India's fight against the COVID-19 menace. The Prime Minister also telephonically reaches out to various doctors, nurses, health workers and sanitation staff from various corners of the country in order to encourage them and to pay gratitude to their yeoman service to the nation and society. PM Modi also interacted with people from various walks of life through video conferencing in an effort to control the spread of coronavirus. He held discussions through video conferencing with the heads of various electronic media groups as well, and with the heads of various print media groups on the 24th of March. The PM in both the cases appealed that media should counter pessimism and panic through positive communication. On the 27th of March, Prime Minister held a video conference with various radio jockeys and announcers of All India Radio. He said need to constantly celebrate the contribution of local heroes at the national level and boost their morale. He also telephonically reaches out to some of those who are affected with the virus and to some who have recovered from its effects in order to keep an update on the progress. PM Modi, in a special video interaction on 25th March with his constituents in Varanasi, appealed for resolve, restraint and sensitivity and exhorted people to adapt to the best practices in fighting the virus. And the nationwide tally of confirmed coronavirus cases crossed the 1,000 mark. The total number of active corona positive cases in the country stand at 901, while 27 people have lost their lives. 95 people have been discharged after recovery. Maharashtra and Kerala have the maximum number of active COVID-19 cases. And joining us now are our reporters from Ground Zero to tell us, to give us the latest details. First of all, joining us is Rishi Kumar from New Delhi and Vishal Baristo, who joins us from Rajasthan. Well, a very good morning to both of you. First of all, coming across to you, Vishal, what is the latest update in terms of number of infected? Is there any, and the steps that are being taken, the response that the authorities are getting from the public?
Well, a very good morning to you, Rukma, and right now I'm standing here at the Jhotwala road, and as you can see, barricading behind me, and police is having a very hard time, a very tough time, because people are regularly trying to break the lockdown with some or the other excuse. Now this is very bad and this is not at all acceptable. You have to stay indoors, and this is what I've been telling people, to stay indoors for your own good, for the safety of the society. As far as the Rajasthan update is concerned, a 41-year-old person who landed from Iran in Jodhpur has been found positive. He belongs to Ladakh and he has been sent to the MDH hospital, Jodhpur. It's a very good thing, Rukma, because he was already in quarantine and there he was detected positive, and all preventive measures are being taken. Now, if he wasn't in the quarantine and had he landed directly in Ladakh, it would have been quite a disaster. But thanks to the efforts taken by the Indian government and Indian Army, such people who have been evacuated from the different countries, especially from the Middle East, are being quarantined both at two different places in Jaisalmer and Jodhpur. Around 500 in Jaisalmer and 500 in Jodhpur, they are in quarantine and they've been medically checked twice a day. As far as the steps taken by the Rajasthan government, two districts, Bhilwara and Jhunjhunu, they continue to be under curfew. And Bhilwara is the epicenter of the trouble, with 25 persons, 26 I beg your pardon, already testing positive. Now this is a big challenge for the government authorities after one doctor who was serving in a private hospital tested positive, and from then on his infection was spread amongst other doctors and the nursing staff. That is why the government is taking all steps, and with 6,000 medical teams, and in 9 days 24 lakh people have been screened in Bhilwara. That's a huge number. Let me tell you that the government is very much aware of what is happening here, because till now we've been dealing with the level 2 of the infection, and we do not want the situation to escalate beyond level 2. And regarding the migratory workers, after directions received from the central government that they should not allow migration of the workers, the Rajasthan government has stopped or blocked all the borders, and the authorities have been asked to arrange all for their stay, for their food and for their shelter. Rukma?
Right, Vishal, thank you so much for that detailed report. And joining us also on the show is Ayesha Khanum from Bengaluru and Rishi Kumar, as we told you earlier. First of all, coming to you, Rishi, we just heard about the problems being faced by authorities in Rajasthan from Vishal. In Delhi too, well, they are fighting great odds here, we believe, particularly because of the migrant laborer situation. However, the centre's directives must have helped a lot in easing the situation. ऋषि, it's over to you.
देखिए, ये जो पूरी आज समस्या है पूरी दुनिया के सामने, इसमें सबसे बड़ी बात ये है कि इसमें जो सोशल डिस्टेंसिंग है वो बेहद महत्वपूर्ण उपाय है, और इसके अलावा जो WHO के गाइडलाइंस हैं, जिसमें कि भारत सरकार ने उसको एक तरीके से स्वीकार करते हुए अपने देशवासियों को कहा है कि उसका वो पालन करें। इसमें सोशल डिस्टेंसिंग ही सबसे बड़ा सॉल्यूशन माना गया है अब तक, और इसको देखते हुए इस समय देश भर में जो 21 दिन का जो लॉकडाउन है उसमें हमने देखा है कि जो बॉर्डर्स हैं, अब स्थिति ये है, दिल्ली और यूपी बॉर्डर जिस समय मैं मौजूद हूँ यहाँ पर, इसको पूरी तरीके से सील किया जा चुका है। लोगों की आवाजाही को ज़रूरत के आधार पर तय किया जा रहा है और ख़ास तौर से जो आवश्यक सेवाओं से जुड़े हुए लोग हैं, चाहे वो डॉक्टर्स हो या मीडिया के लोग हों या पुलिसकर्मी हैं या जो खाद्य पदार्थों से संबंधित जो आवश्यक वस्तुओं का जो सप्लाई है उससे जुड़े हुए जो लोग हैं उनको ही सिर्फ आने जाने दिया जा रहा है। और यहाँ पर हम देख रहे हैं कि दिल्ली पुलिस, यूपी पुलिस और पैरामिलिट्री फोर्सेज जिसमें कि बीएसएफ के जवान भी इस समय तैनात हैं बॉर्डर पर, ये सभी लोग इस बात को सुनिश्चित कर रहे हैं कि जो सोशल डिस्टेंसिंग का जो टारगेट है देश का उसको हर हाल में पूरा किया जाए और लोग अनावश्यक रूप से घरों से बाहर ना निकलें।
Right, Rishi. Well, thank you so much for those updates. Aisha Khanum, now, well, it's over to you from Bengaluru. What are the issues that are being faced as the country enters day 6 of the 21-day lockdown? What are the kind of challenges that are being faced? How are people responding?
Well, Rishma, now it looks like the panic is settling down because people have been convinced and they have been told that there is no shortage of essential supplies, there is no shortage of food. So therefore, the panic seems to be now settling down because in many places across these states, there have been grocery kits that have been distributed to people, to the needy. And also remember, this is not a flood-like situation where people cannot cook at home. So people are just restricted from coming out of their homes. So therefore, the fact that people have been told to stay at home, they now realize that the only way to fight corona is to stay at home, and that is the only medicine to fight against corona. And this is one side. And on the other hand, the government has stepped up efforts, and also they are creating more better health facilities. Hospitals are being set up as a contingency measure. Some marriage halls are being converted into community halls wherein the needy and also the laborers, the migrant population also in Karnataka can stay put there, and they have been assured that they will be given food, they will be given shelter till the crisis is over. So now the government is trying to assure people that there is no need to panic, and the fact that in Karnataka, especially in two districts, Chikbalapur and Gauribidnur, there are increasing cases of corona reports, and these two places are just bordering Bangalore city. This is about 80 kilometers away from Bangalore. So the borders have been sealed, all the district borders have been sealed, and health and medical emergency has been declared in these places where the cases are rising. So the government is fighting this and taking all steps on a war footing to see to that the number does not rise. And
Right, Aisha, we'll have to leave it at that. Thank you very much for joining us, and we go across now to Mumbai, where joining us is our correspondent Shishir Shelar. Shishir, well, Maharashtra, one of the worst affected states as far as India is concerned, but there are various challenges also as the country goes into day 6 of the 21-day lockdown, which has been assured is the only way to prevent the onslaught of COVID-19. How are authorities there coping? What about supply of essential items? Well, how is Mumbai shaping up? In this time of crisis, what about the centre's, also we'd like to know about the response to the centre's directive to seal the borders. Shishir, if you can hear me.
Well, absolutely, Aisha, as you rightly said, Mumbai is most affected, and that's the reason the government have taken extra precautions to tackle the situation here. Right now, I'm in Thane, and behind me you can see this machine. This machine actually sprays the disinfectant across the city here, and that's the reason that the Thane Municipal Corporation has bought this kind of machines here. I have actually given this support from the organization. The private companies have extended support and have given this machine to spray disinfectant in across the Thane city. I will show you the visuals here, basically how this exactly machine works here. Because if you look at the entire machines here right now.
Shishir Shelar from Mumbai giving us those visuals of efforts by the authorities to disinfect the environment, to disinfect the surroundings.
Absolutely. Right now we have with us
Tushar Trivedi.
Tushar Trivedi from Thane Municipal Corporation.
From UPL.
From the UPL. How does this machine work exactly?
So actually I am from UPL, and we are bringing this machine. We already, this is our Falcon machine. With the machines, we are providing our operators, and we are giving this entire services free of cost to the municipal corporation.
How far this area has covered so far?
So we have almost covered around 8 kilometers of area since yesterday evening, and within a day we can cover almost around 35 kilometer area, and that is which we are starting from today morning. That almost around 7 kilometers we have covered, and for entire day, working day and night, what we are thinking that entire Thane Municipal Corporation area we can cover within next 3 to 4 days.
What are the results you see of this machine here?
So basically, you know, like it is a decent.
Well, thank you very much, Shishir, for those details, for that update. So in every state, in every union territory across the country, all hands on board as the fight against COVID-19 continues. It's day 6 of the 21-day lockdown. That's all we have in this special edition of Tracking COVID-19. And as we wrap up, we leave you with these glimpses, with these visuals of precautions that have to be taken at this time. Experts from AIIMS New Delhi shared some basic steps on hand washing to fight coronavirus. Take a look. Namaskar.
Hand wash should take about 1 minute. Before you begin, remove all your jewelries or count from 1 to 10 in each steps. Wet hands with water and apply enough soap to cover all surfaces of the hands. Let water run smoothly to avoid touching the tap. Rub hands palm to palm to obtain a good quantity of foam. Rub right palm over back of left hand with interlaced fingers and vice versa. Rub again palm to palm with fingers interlaced. Rub back of fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm and vice versa. To clean tips of fingers, rub rotationally backwards and forwards with clasped fingers of right hand over left palm and vice versa. Rinse thoroughly with running water. Dry hands thoroughly with a single-use towel. If tap is not elbow operated, use this towel to turn off the tap without touching directly. Your hands are now clean and safe.